Let me just tell you about this guy they call Hatti. From the day Hatti was born, Hatti has been working. What's Hatti's job? Carry important supply from this place and send it to other vital places. Hatti has been working since the day he was made. He has never gone on break, he has never gone on leave, he has not even done holiday. Now, the problem is the day Hatti goes on leave or he goes on break, things around him start to die. Why? Because all those people depend on Hatti. But the Hatti that is doing the work also needs the vital supply of the things that he's supplying himself. So it's very important that Hatti himself is fed well, and not just fed well, fed adequately. Problem is that in some places, Hatti does not used to eat food like that. They have blocked the pipe that used to feed Hatti. And Hatti, instead of still taking break, continues to work, thinking that by working harder is going to solve the problem. Sometimes, some people make Hatti's job harder, but Hatti will try to push against pressure. Why? Because perspire to aspire to recover the container has already entered his blood. If by this point, you don't know what I'm describing, you better leave this video and go away, because the major thing that we're describing is your heart. Yes. Today is World Heart Day, Abi, and the theme of today is what? Use heart, no heart. Because the better you know, the more you can take care of it. So let's talk. Now, that pokum that's going on inside your chest, what exactly does it mean? Let's now tell you. Inside your heart, there are about 4 rooms. There's the atrium and there's the ventricles. Some of those rooms, which is called the atrium, are responsible from just receiving blood. Some can receive from the lungs, others will receive from the other parts of your body. Then the remaining 2 rooms are called ventricles. They are responsible for forcing blood out of your heart. Whenever they relax and they contract, you hear bokum, bokum, right? Now, it's supposed to be regular. How many times? It should be less than 100 times at rest. If it's more than that, it's a problem of something we know as tachycardia, which could mean that something is going on, that your heart is beating faster than normal. If it's lesser than 60 beats per minute, sometimes it could be a problem that is known as what? Bradycardia. But in people who have trained their hearts, athletes, they are, they've done all the running in the world. It could also mean that they've trained their hearts well enough to handle lower pressure, so that when they run faster, it does not go very high. The heart that is doing the kukum since the day you were born also needs to be supplied by blood itself. Now, the things that supply the heart, the blood, is what we know as coronary arteries. Why are we mentioning these arteries? Because these arteries are very, 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 very important. Because the next things we're about to say are some of the things that damage the hearts of people. Number 1, hypertension. We have been saying it since. Hypertension is a silent killer. It does not have any symptoms. You need to understand how it affects your heart. How? Simply because in hypertension, one of the major things that happen is that the blood vessel, instead of being normal, is about narrowed. So it's harder for blood to go through those vessels, increasing the workload on the heart. If the blood has more pressure to work against, what happens? It starts to pump more. If it pumps more, it starts to get bigger. But the problem is, as the heart is getting big from hypertension, the room inside is not getting bigger. The room inside is getting smaller because the muscle is getting bigger. So it means that very few blood enters the heart. As few blood is entering the heart, it cannot pump out much blood. The people that are supposed to receive the blood, they are shouting. So they send message to HR. HR is sending message to the heart. Work harder. People are not getting enough blood. It continues to pump. The more it pumps harder, the bigger it gets. At some point, they have to give up and say, I'm tired of working. That's what we know as heart failure. Another thing that also affects the heart is cholesterol. You see, this one is very important because some of the things you people are eating is causing problem for you, especially people that like junk food everywhere. Some of the things they do is that they increase the level of cholesterol in your body. But not just any kind of cholesterol, they increase the one we call LDL, which is low density lipoprotein, which is bad for your heart in very high amounts. Now, what this cholesterol does is that after a while, if it's too much, because the body does not like to waste things, it will go and start dumping it in places, which is where? Sometimes inside your blood vessel. So you can have your blood vessel like this and it has dumped it inside. If it dumps it inside, it reduces the space that is inside the blood vessel, increasing the pressure that the heart needs to pump against. Other times, it can even deposit in the vessels that supply the heart. Remember, we talked about the coronary arteries. Some of you have already forgotten. Come back. Inside the coronary arteries, if it deposits inside, it's reducing the amount of blood that gets to the heart itself. And if the heart is not getting enough blood, some of those heart muscles start to die off. Before you know what's happening, cardiac ischemia. Before you know what's happening, heart attack. So my dear, if you have not checked your cholesterol levels, you need to start going to the hospital to go and check and start reducing the things that contain very high cholesterol. Another thing that increases your risk of heart disease is something we know as diabetes. Yes, we know, doctor, what concerns diabetes and hypertension? I thought they are two different things. Yes, because diabetes is what? Increased blood sugar. But that increased blood sugar over time can start to damage blood vessels everywhere in your body. And the one that supplies your heart is also not spared. Diabetes will destroy it too. So manage your blood sugar, check your blood sugar. Other things that can increase the work rate of your heart or increase your risk of heart disease is another thing we know as obesity. Obesity is a risk factor for so many things that can go wrong in your body, and heart disease is one of them. Look, see, if you are smoking and you are still watching this video, usually smoking cigarette, tobacco is part of the problems also. Why? We talked about smoking reducing blood supply to certain organs, and your heart is also part of the problem. Now, if you don't exercise, off this video and go and exercise now, then come back when you've exercised. Why? Because like we always say, when you exercise, first of all, your heart increases its work rate, your blood vessels enlarge, reducing the amount of work that your heart has to do over time. Most importantly is keeping your heart healthy. It's very simple. So, my dear, go and exercise. So, use heart, no heart. We are here. Let's now bring it down to what we can understand. Emeka, you go out with your friends. They are smoking shisha. We join them and smoke shisha. Meanwhile, your father has hypertension. Your mother has hypertension. Your father's uncle's sister's son has hypertension. Her uncle's sister's uncle's mom's aunts. You understand where I'm going to? In other words, there's a risk factor for hypertension that is in your family line. They should not catch you near it. Am I saying that people that don't have risk factor can continue smoking as much as they like? No. Don't hear what I'm not saying. What I'm saying is that there are certain particular risk factors that are with you. Or you find out that you're beginning to add a little bit of weight recently that is unhealthy. You climb 5 flights of stairs. Your heart is beating as if it wants to fall out. You need to understand that that is when you should take note and start to take better care of your heart before things go south. Or you have a very stressful job. Yes, I understand. But there's risk factor of hypertension. You should start taking care of your heart. Or you, around you is nonsense food. Or you know that, somebody somewhere that is in your family all of a sudden held his chest one day and they said, what killed him is hypertension. It means you should start paying attention to the kind of food that you eat. Reduce the amount of cholesterol that is in your food so that your heart can continue getting proper blood supply. But what's important for almost everybody is this. Number one, you should exercise. No matter how many forms of exercise, if you cannot run, walk. So try to do at least 10,000 steps per day. Number two, stop smoking. See, there's no benefit of smoking in this world. Tell me one benefit that's good for your body. None. So why are you taking it? Number three, alcohol. Yes, those of you who take insane amounts of alcohol, it also affects your heart. Number four, check your blood sugar. Look, any combination of diabetes and hypertension or heart disease at the same time is usually very deadly. One final thing that I need you to understand is that there are some things you can change and there are some things you can't change when it comes to risk factors for heart disease. But we'll start from the things you cannot change. Number one is your age. Because over 35, the risk for coronary heart disease starts to increase. Number two is your gender. It has been found through research that men are more at risk of heart disease. Number three, if you're black, you need to know that you are at higher risk of heart disease than other people. Look, the things that you can change, that is why we are here, so that you can focus on those ones. Number one, which is what we've mentioned all since we started this video, smoking, exercise. Don't sit down in a place for too long. Make sure that your muscles are always working. Make sure that your diet is proper. Pay attention to these things because they are always important. But in your journey to using your heart and knowing your heart, you need to also understand that you need health professionals around you. When last did you go for a heart checkup? Look, it's very important. Your heart cannot just be beating funny. Things are giving you symptoms, but frequent checks with your doctor, with your heart specialist, will make you or help you keep your heart in optimal health. So I hope you now understand your heart better so that you can use it better. We started with what? Use heart, no heart. No, we're not even halfway done. That's my problem with hearts.